from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back into Good Morning Arkansas, everyone. Many things have been placed on hold because of the pandemic. This is something that's not new to us. But your quality of life does not have to be one of them, right? So if you are one of the many who possibly deal with maybe some hip or knee pain, and you need to stop and take a look at that, you need to pay attention. Joining us this morning is Baptist Health orthopedic surgeon, Dr. John Yocum. Dr. Yocum, thanks for joining us. Let's jump straight into these questions here this morning. How common is hip and knee pain with some of your patients?
We see hip and knee pain very commonly, probably the top two things that roll in here for evaluation. So very, very great deal.
Absolutely. For those who are watching who may experience hip and knee pain, when is it time to come see you?
We generally would say that you should come in when you begin to have limitations in your activities of daily living, and limitations in doing the things that you want to do is probably a good trigger to come in and get evaluated.
Absolutely. So we want to know what can be done for these patients and with this type of pain that they're having, and when is it time to maybe consider that a knee or hip replacement is an option?
Well, we have a toolbox that we use for people that have arthritis of the hip and knee that would include anti-inflammatory medicines, maybe physical therapy, maybe intra-articular steroid injections, and they also manufacture synthetic joint fluid injections that sometimes are very beneficial. So all those we employ.
I see. And what kind of surgical options do you have? Go into that a little bit.
Well, when it gets to where those conservative or non-operative measures don't work anymore, then we begin to give consideration to joint replacement. And those joint replacements would include a partial knee replacement, total knee replacement, and total hip replacement, all of which we do here with robotic assistance, which is a relatively new technology, period.
Okay. Dr. Yocum, why do you think patients should consider this type of procedure that you're talking about today? And what kind of things should they be asking when they're maybe making this decision to have a surgery like this?
Well, I guess that before having a total hip or total knee or partial knee, that you need to understand what the risks and benefits are. Certainly preparing oneself for what's going to come. It helps maybe with getting through the process. What is the recovery period? What is a hospitalization? And when might you expect to be able to return to activities that you enjoy doing?
Okay. And what would you say, you just kind of touched on this a little bit, but maybe speaking on more of those benefits for this particular type of surgery over other options?
Well, the robotic process allows us to kind of tailor the joint replacement to each individual. More conventional techniques don't really allow you to do that. We perform a CT scan of the knee and or hip before doing this robotic procedure and can kind of plan the cuts that we're going to make before we ever go to the operating room. What's really unique to this robotic process, the Mako process, is that you can then, during the operation in live time, kind of adjust the ligament tension by tweaking the way the cuts are oriented. That I think really makes a difference in the outcome in these patients, really results in a more balanced knee, and in the hip allows you to reestablish the length and offset, and maybe results in a more natural feeling joint.
Okay. And Dr. Yocum, we can listen to you talk about this surgery all day long, but I bet what a lot of people would want to know is, what are these patients who have already received this surgery and have done this procedure with you? What are you kind of hearing as feedback from some of them?
I've done, of course, conventional knees for many years. We've started the robotic process and have done over 2,000 at Baptist. So we've got a good bit of experience with this particular robotic process, the Mako process. And I've done a number of patients years ago that had a conventional knee and then subsequently came and had a robotic assisted process, and pretty much all say that the robotic knee is superior in function for them. So I'm hearing that they like it and that it works very well and they're very pleased with it.
Good. Well, it's always a great thing to hear a recount of those people who are actually experiencing this procedure firsthand. Dr. Yocum, I want to ask if any of our viewers at home are interested in maybe learning more after hearing some of this or going for that procedure, where should they reach you? What can they do?
Well, we're here at the Baptist Health Orthopedic Clinic at 9101 Canis. They can call us on our telephone at 501-217-3533 or through the Baptist Health line, and we'll get them seen and evaluated.
All right, Dr. John Yocum, orthopedic surgeon with Baptist Health. Thanks so much for coming on and sharing that information with us.